Welcome, everyone. I'm particularly welcome to the Mental Health Warriors. I'm Dr. Bev Marais, and I am a psychologist and eating disorder specialist. And I'm here bringing you the first session today of Table Talk, where I'm going to be talking on a regular basis about all issues relating to food, eating, mental health around that, body image. So I would really welcome any questions that you might have in response to that. So let me do the introduction video and I'll get back to you. And welcome back. So once again, I'm Dr. Bev Marais, and I'm here for our first edition of Table Talk, where I talk you through various issues relating to eating disorders or disordered eating and concerns around that. Now, today's session is going to be around the emotional impact of eating disorders. I'm conscious as I say that eating disorders impact people on all sorts of various levels. There's emotional, psychological, social, relational, physical, in every way. So I'll try to cover some of these really as we go along. I've got some slides, so please bear with me as I upload them and bring them up so that we can have some visual as I talk through. Now, if there's any questions at all, please do pop it in the comments box and I will get back to you and respond to them as and how I'm able to. So now let's begin. Let me find my slide. Okay, so yes, so it's the impact of eating disorders on us emotionally, physically, psychologically, and I'm going to talk through the different types of eating disorders as I do this. And hello, Adam. Right, so here's what I'm going to cover. I'm going to cover something about bulimia, a little bit about anorexia, and a little bit about binge eating. So those tend to be the main eating disorder categories. However, most people fall into a mixture really of them. So yes, so I'll talk you through some of them. Let me go on to the next slide. Now, generally, when people come into treatment for any type of eating disorder, it's very often because it's impacting the quality of their life actually quite considerably. So people might say things like, actually, my willpower isn't working anymore, or I used to cope, my body worked really well with the way I was eating before, and for some reason now nothing's working and I'm feeling really out of control. Some people might be feeling very scared about food and their relationship with food. Some people might be avoiding going out as well because of social commitments, and a lot of social commitments really are around food. Some people might be saying, either having sort of really all or nothing mindsets where they're either eating everything or nothing, or feeling like there's no middle ground at all. Some people are very anxious, really highly anxious around being even sort of in relationships and family times because of preoccupation with food and worries about what other people would think and how to manage and negotiate these situations. Sometimes people would be waking up every day thinking, oh gosh, I already know it's going to be a bad day and things are just going to go downhill. Or I'm hungry, I'm full, yet I want to eat, I don't want to eat, really confused and struggling with their body's hunger cues and signals, and actually just feeling tired and fed up most of the time around what's happening with their eating patterns. So that's often the point when people come into treatment. They've often tried several types of strategies. And very often when it comes to eating issues and eating disorders, dieting or going on diets tends to be one of those things that people have tried several times, and at the point where nothing's really working. So let's see. Okay, so as I said, I'm going to talk you through the different types of eating disorders. Now, this first one we're looking at is bulimia. Now, bulimia tends to be characterized by mainly things like restriction, or wanting to restrict or limit how much you're eating every day. But the problem with restriction is it very often elicits binge eating. There's a whole sort of overpowering almost mechanism within the body that means that you're just sort of wanting to continue eating even despite being restricted. So there's a question here. So when an individual is hungry, do you think it's okay to wait 10 minutes to see if you're actually hungry? Absolutely, absolutely. I think there's a difference. This is why one of the first recommendations that we have whenever we're thinking about treatment is to first think about how can you order your eating in a bit more of a regular routine way, so that you can learn a little bit more about hunger and when your body responds to hunger or not. Because when people come at this from a disordered eating perspective, it's really difficult to understand hunger cues in any way. So very often with binge eating, there's an urge to want to eat and to binge. So it often feels very out of control. Whereas with hunger, you can sort of delay it a little bit. It's not that out of control. So that's one way of recognizing it. So delaying it essentially means time to think and to figure out whether this is working or not, whether you're ready to eat or not. So with bulimia, very often people start from the place of feeling really perhaps unhappy with themselves, potentially low self-esteem, unhappy with their body, and then really wanting to make changes to make them feel a little bit better. And they start off with thinking, well, they need to change their bodies, clearly, because then they'll feel better about how they look and how they feel, and their life will change. But unfortunately, the way people do that is often through quite rigid, restrictive meals and diets. And that means that any restriction often sets people up for a binge. If you think about society and looking at how, as human beings, how we respond to scarcity, whenever we're limited in any way, or whenever we're sort of telling ourselves that, oh, there's only a certain amount that we can have of something, there's often this powerful urge to just have as much of it as possible. So we can see this really in terms of what happened during the pandemic, when people, when say maybe there was food scarcity and stuff in supermarkets, so people would be sort of buying quite a lot, almost hoarding food in a sense. We could see it with the toilet roll, getting loads and buying loads of toilet roll in response to scarcity. We can see it in terms of the fuel crisis here and there. We can then continue seeing, say, with the fuel, the queues, people sort of really hoarding. So it's that sort of human nature, really, that happens in response to scarcity. And exactly the same thing happens when we're telling our bodies, or we're not allowed to have this, or there's only a limited amount. Now, with bulimia, it's often very, very restrictive, and really kind of quite rigid rules around what's allowed and what isn't allowed. So it's a very all or nothing type mindset. And when that happens, because inevitably it's not sustainable, rigid rules aren't really so sustainable. People break the rules and then they end up feeling really bad about themselves in some way. And then there's the guilt, and the rules will inevitably be broken. So that's really the challenge with bulimia. It starts off with restriction. And then, of course, people break their food rules and then they feel bad about themselves. And then what they'd go to do is to compensate for the food that they've binged on. And compensation can involve various things. We call it purging behaviors. So it would be something like some people might be vomiting, some people might use diuretics or laxatives, some people might even be over-exercising of sorts. Let's see. What advice would you give an individual who lives with autism, who wants to keep eating and eating to keep their energy up over an individual that doesn't have autism? See, here's the thing. I'm really not an expert on autism. That is very specialized. And I know there's so many practitioners that do specialize with autistic patterns really around behavior and eating, because of course the cues and the processing is very different. So yes, I can look into it and get back to you and find some responses for that. But it's not really my speciality. Yeah. So now with bulimia, you have you have the restriction, the binge eating, the compensatory behaviors, really that are going on, and people feeling kind of quite out of control. Remember, the compensatory behaviors, the purging, etc., that happens is that people tend to use that as a way of compensating for the amount that they've eaten. So they sort of thinking that it's sort of weighing itself out. So as long as they're getting rid of it, it doesn't matter about the binge. Of course, that's not the case in terms of what the body or how the body actually copes. Because what happens over time is that this is why people come into treatment, because the measures that they're using to manage their weight really isn't working over time. And that's because it's not a long-term weight management strategy. Okay, so I see a message. I suspect my daughter has ARFID. This is very rarely recognizable in the UK, and I'm having a hard time getting my community pediatric doctor to take this on board as she's under a higher consultant. Any advice? Let me think. I mean, ARFID is a recognizable eating disorder, and it's incredibly difficult if your medical support isn't necessarily recognizing that. There are services, and I'm not sure really where you are, but certainly in the UK there are services in the NHS that do have special assessment services for ARFID. So your GP should be able to direct you really to those services for support and help. And what they might do is initially have an assessment. And based on that assessment, they will then think really about a treatment plan or what their recommendations might be. But in the UK, the first point of call would be going to your GP, who would then refer you onwards to another service. I hope that helps. Okay, so just going back to bulimia again, and what happened, I can see that ARFID is something that is, it's something that people are learning a lot more about. And unfortunately, there aren't services all over that deal with ARFID, but it's something that I can look into and maybe bring up at another point. In fact, I have a colleague I'm thinking about right now that specializes in working with ARFID, and it might be that I can bring her on as a guest another time and ask her some questions. So keep posted, and I will certainly let you know when that session's coming up. Okay. Okay, so with bulimia, as we say, there's the restriction, binge eating, the compensatory behaviors, and of course, if we're thinking about the impact on someone's life, really, with all of this, it's quite detrimental, because a lot of the eating is done in secret. So there's a lot of shame attached to how people then eat. People are then having to be really resourceful and disappear at the end of meals, etc., make up all sorts of excuses not to go out, especially if people are using laxatives. They can't then go anywhere for a day or a couple of days, depending on how much they're using. And of course, especially with laxatives, people's tolerance level increases over time. So then you have people needing to use more and more laxatives over a period of time, which then, of course, is going to impact their intestines and digestive system quite markedly. So yeah. And then let's see, as a result of, say, what happens with vomiting on the body, it leaves the body quite dehydrated. It compromises the electrolytes that is needed for functioning in the body. The organs can be impacted. There's acid reflux that happens. So teeth and enamel, often people are having to have quite regular dentist appointments, and the work that might need to be happening on their teeth can be quite severe sometimes. And of course, mentally, because of what's going on, their body's not necessarily functioning in the best way. There's often a lot of challenges in terms of concentration levels and the ability to focus on things, because a lot of the time the focus is on food and body image and weight and shape, and constantly trying to find ways of managing that in order to feel good. So with bulimia, absolutely, it can have quite a detrimental effect on people's quality of life. And let's see. Okay, the next one is anorexia. So anorexia is, again, really marked with significant restriction. There's the relentless pursuit of thinness and being as thin as possible and losing more and more weight. There's a lot of body dysmorphia often associated with anorexia. And there's often an intense fear of weight gain and eating actually certain foods. So very often, the reason why it's dangerous is actually whenever we're withholding proper nourishment from the body, the body is going to ultimately become impaired over the longer term. And that's the body's ability to function, again, is going to be compromised quite severely. And again, with anorexia and the reduction of food and nourishment means that the brain then can become very malnourished. And that means that people will struggle concentrating, focusing on things. The ability to make decisions becomes quite difficult. Any sort of complex thinking styles become difficult. Complex decision making becomes difficult, because the brain, what happens with anorexia is the organs in the body shrinks. So people can lose gray matter as a result of restriction at that level. And so it becomes even more difficult to identify emotions, because again, with anorexia, emotions are shut out, they're blocked out in some way. Similar, one of the main themes with all of these eating disorders is the ability, or the inability rather, to regulate emotions and to tolerate emotions. So that's a common theme really in all of these. And let's see. So again, physically, as a result of malnourishment, the body is able to look after itself in the best way. People might find that their hair becomes brittle or thinner, nails become brittle or dry out. That people might have difficulty regulating their body temperatures, and they might feel cold a lot of the time. There's all sorts of intestinal impacts really around anorexia. Very often as a result of restriction, changes happens really in the digestive system. And there's something called delayed gastric emptying, which means that digestion slows down really quite dramatically. And as a result, people might eat, where when they do eat, they might then feel really bloated and really uncomfortable, and it can be quite painful as well. And people often interpret this bloating as, oh gosh, they've now gained weight, which isn't true. It's really the body taking a lot longer to digest food and work with that. There's, of course, and as a result, there's an increased risk of all sorts of gastrointestinal disorders, and people often, just in terms of mood, their mental health suffers quite a lot. They tend to, as a result of the basic need of food and nutrition, they are unable to, as we said, regulate their moods. So what happens instead is people then can become quite irritable, quite snappy, angry, frustrated, depressed, low, increased, anxious even a lot of the time. So again, really difficult to regulate these mood states, and these can allow people to feel even more out of control, and also believe that emotions are scary, and restricting even more to shut out and block out difficult emotions. And of course, the longer term impact of having anorexia is often that people are having to be in touch with their treatment team a lot of the time. So people are in and out of appointments. Their life is often almost revolving around treatment and the support team. They would be having regular blood tests. They might be physical health checks happening. And if there are abnormalities that are showing up, they having to go in and out of hospital. Their immune systems become compromised over time, so it's really easy for them to catch viruses and bugs and everything. And whenever they do, it takes longer and longer for them to recover. So again, if we think about the quality of life, then it becomes really very, very compromised. And people then become more isolated. They don't have a lot of energy anyway, not a lot of fuel in the body to cope. So work life is very compromised. People don't have the energy really for a full-time job. So relationships are also affected. You'd have family members perhaps that are concerned. People then maybe wanting to avoid relationships, so becoming even more isolated. So the impact of anorexia long term is really quite marked and quite severe. Over time, as people's lives become almost smaller and smaller because of the anorexia, they become more and more attached to the anorexia, and because it's giving them all sorts of, or it sort of gives them the illusion of goals and everything, because they aren't able to access any of that in other parts of their lives. And let's see, where are we now? Okay, then binge eating disorder. Binge eating disorder is generally characterized when people have, or typically have, large amounts of food over a short period of time, but that this is happening on a regular basis. Bearing in mind that in terms of normal eating, it's natural that people sometimes eat more food or less food, say here and there. This is a disorder when people are using this as the only way of coping with things and actually feel quite out of control, really, in this sense. And one of the distressing things with binge eating disorder is that it can lead to weight gain. And people then feel even further out of control of their bodies in that sense. Again, another typical feature with binge eating disorder are the intense or sometimes extreme feelings of guilt or shame that happens when people are engaging in binge eating episodes. Very often with binge eating or even emotional eating, people do feel a lot of shame attached to these conditions, because they would often say things like, or even with bulimia and anorexia, they would often say things like, but it's so, eating should be something that I should be able to do. It's so straightforward, and not really understanding why that's not the case, and why they're struggling, because sometimes people are super confident or competent in all sorts of other areas of their life, so don't understand how they can let themselves down really in this way. So it can be a very, very shaming experience for many people. And let's see. So with eating disorders, the focus is very much on food, but we know that it's a lot more than that. It's actually quite complex. There's a lot to do with past experiences that people have had growing up, things that would have been outside of their control, a lot of significant things that might have influenced how the trajectory of developing an eating disorder. There could also be genetic influences involved really along the way. And we know that low self-esteem is a feature among most eating disorders, and people trying to find all sorts of different ways of coping really with it in some way. And this really is a little bit of a wheel, looking at, the emotional part of, our emotions and what happens with eating and emotions, essentially. The bottom line in all of this is to recognize that all of these behaviors, whatever apparently dysfunctional behaviors or disordered type of behaviors people engaging, all behaviors serve a function, and all emotions serve a function. Now, if we're thinking about the sort of functions or the types of emotions in the inner circle, there's anger, happiness, sadness, anxiety. The four basic emotions. These are our four basic emotions, essentially. Now, there's millions of varieties of those emotions, but we can narrow it down. We can simplify it to these four basic emotions, primary emotions. Whenever we're not allowed to experience our primary emotions, we develop secondary emotions, and the secondary emotions are guilt and shame. The challenge with guilt and shame is there's nothing we can really do with guilt or shame other than feel bad really all the time. They're not emotions that help move us forward in any way. Now, guilt and shame is often covering underlying emotions, often covering these sort of primary emotions. And if for example, someone might be feeling guilty about eating, or someone might be feeling about a binge, perhaps. Now, if they, what's really going on is they're feeling scared that they're out of control. They might also be feeling sad, that they've let themselves down. They might be feeling angry with themselves. Those emotions you can do something about. You can think about it. It's meaningful. You can work with them. Guilt, nothing really. So those sort of guilt and shame emotions, we're almost wanting to break down a little bit more just to understand, so what's underneath it? And there's often a mixture of these emotions underneath it. And what do we, okay, so the underlying question really is, what feelings are you feeding of sorts? So you're either feeding anxiety, low moods, anger, frustration, what's going on? And when I say what are you feeding, it doesn't necessarily mean eating. It could be even avoidance and not wanting to eat in order to protect or shut out emotions really in some way. So it's quite a complex set of dynamics, all of this. And so this is just a little bit that talks about actually what the next steps are in terms of motivation to change. Now, with any eating disorder, whether it's binge eating, anorexia, bulimia, ARFID, or a range of whatever eating disorders are going on for people, or a mixture of them, there's always going to be a bit of ambivalence around change. And the reason again is those behaviors serve a function of sorts. So the reason why someone's engaged in bulimia, there's a function underlying that. It's maybe around, oh, I need to do this to manage my weight, or I need to vomit to get rid of, or to empty myself in some way because that feels good, or I feel better, or I think I'm doing something. With anorexia, it could be, food is scary to me, and I'm so scared about weight gain. So therefore I need to just restrict or shut it out or block it out, or not even like any food, or limit it just to these amounts that I can eat every day. With binge eating, it can be something like, but I want to eat, or food gives me some pleasure, or there's a little bit of a reward system being triggered, say with food, so it feels good. And for that period of time when I'm binging, I don't have to think about anything else. I don't have to deal with issues or problems or stresses or emotions. It's just all about the food. But then, of course, there's the other side of that with all of this. There's the distress and a lot of the things that I mentioned earlier about how it impacts really people's quality of life. So very often around change, there's so much ambivalence. There's one of the first things we think about very often in terms of where people are at with change is, what are the pros? What are the pros of staying the same? Because there would be all sorts of pros, and some quite powerful, of staying the same. What are the cons then of staying the same? Again, what are the negatives that keep popping up? And then we want to find out, now, what are the cons of making changes? Those are the risk factors. That means you're now having to tolerate uncomfortable emotions. You're now having to manage exposure, say, to different things, and again, tolerate all sorts of other things around that. You're having to learn how to deal with change. But all of this, it's a really positive thing, even though it's scary. But very often, which one of the things why this is really important is because we need to sort of often think about, what are the plans in place to help deal with whatever's going to come up when you try to make changes, so that it feels safer to take that step forward. And then the other bit, now, what are the pros of making changes? What would be the goals that people would want to work towards, that can help motivate them really in their recovery? Now, what was this? What is your view on the saying, we are what we eat? Okay. I see, now this is the thing, I would really disagree with that, because I don't think it's that simple. In fact, I would say we are not what we eat, essentially, because we're so much more complex than that as human beings. How we're eating is really about how we were raised, what we were exposed to growing up, any experience, perhaps genetics, some sort of physical health issues that might even be going on for some people, that then inform how they're having to eat. And it's really, I think it's quite limiting thing, seeing yourself as you are what you eat, and that's then your identity. So that's essentially how I would respond to that. And what else? Okay, so in fact, that leads into exactly this slide, which is actually why people eat the way they do, is very much dependent on background, early experiences, current stresses that might be going on, learned behaviors, all sorts of things. It's never so straightforward as, I'm just eating. There's a whole sort of complex array of things that are going on in the background, and a lot of dynamics. There's a lot of underlying causes really around it, which is why very often it's not so simple as, oh, I need to try this diet, or I need to try that, or I need to, because it's not even so much about the food. It's a lot about a lot of other things that are going on behind the scenes. The other thing that's quite important in terms of making changes with all of this is about learning what some of your triggers might be. And that might be as simple as identifying patterns. Oh, it's normally in the evenings that I might binge eat, or it's after arguments, or this happens, or haven't eaten all day and therefore I've binged. So it's identifying triggers And for some people with anorexia, really as well, what is it that makes people want to restrict even more, which again could be anxiety about all sorts of things, or changes that might be happening, or relationship issues, or worries about something else that's going on. So beginning to identify triggers means that you can learn how to problem solve the triggers in a much more meaningful way, rather than just changing this food or that food or cutting XYZ out. Okay. Do you feel trauma has a pro factor in eating disorders? Yes. Having said that, it's not the case for all eating disorders, but absolutely for a lot of people, trauma would inform how they then cope with eating. So some people, for example, might have an experience, maybe a really negative abusive potential experience, say growing up or being exposed in relationships in some way, in a really unhealthy way, and that's going to bring up a lot of distress and anxiety. And people then have to think, well, about how to cope with stress and anxiety. And very often for a lot of young people, teenagers growing up, the brain's still developing. The part that regulates emotion, the frontal lobe, that's not fully developed yet. So they don't necessarily have the skills to deal with all sorts of traumatic experiences. And then it's so this is where, even where addiction sort of fills in a sense, because people are often looking at ways of soothing themselves emotionally, whether it's drugs or alcohol, or even using eating as a way of coping with uncomfortable feelings. Okay. And again, this, I've put the slide up here, but it's something that I am likely to follow up on in a lot more detail further down, in other sessions, where, thinking about, what are the strategies that help support people in recovery. And there are really so many. And the challenge is, because there are so many, it's really easy to try this and that, and a bit of this and a little bit here and there. And sometimes that's not really effective. And it can make people think over time that it's hopeless. They're not really having, they're not really being able to think about food really in the best way. What's this? Do you think having a knowledge of food types and nutrition is helpful? Yes, it is helpful. And I think a lot of people that struggle really with eating and are having to get back into a better eating pattern and routine, sometimes need some sort of correction really around how they're eating, and really need a little bit more psychoeducation and dietetic information on actual foods, what they mean, why they're good for you, and why your body needs it, as opposed to a lot of the information that they might have access to in other areas that might be a little bit biased or more sort of diet focused. Okay, so this is, I mean, you can't really read this very well, but this is almost a pathway really to recovery. Again, this is something in future sessions that I can go into in a lot more detail. It's things like the now bit right at the bottom is that sort of pros and cons bit initially. It's sort of, where are you in terms of motivation to change? The overall framework that I've sort of created here, the acronym is BECOME. So it looks at building motivation to change. What is it that's getting in the way? What are the things that are resisting change? What are the obstacles, and how can we overcome this? And again, motivation changes throughout treatment. So we're always sort of monitoring that and looking at it. It's not a linear pathway, even though it looks like that. It's very sort of up and down. Embracing embracing nutritional needs. Again, that links in with what I just spoke about a moment ago. A lot of psychoeducation around around food and nutrition, and why it's important, and getting into a structure around normalizing or regular eating patterns. And the next one, what's that? Changing your mindset. Yes, so we're looking at cognitions, how to restructure your thoughts and thinking, and responses to food, eating situations, your body, and to shift it and move it away from the eating disordered thoughts to more sort of self-compassionate, constructive ways of coping with situations. We're looking at body image, because again, that's another important thing that motivates people in recovery, and as well as sort of generating an ambivalence as well. The changes that happen in bodies change, that's inevitable, and it's learning how to tolerate those changes and how to accept bodies, really as well. So there's a lot of work that is often goes hand in hand with body image, body dysmorphia issues that arise with a lot of eating disorders. Moods, mastering moods and emotions, again, something that I touched on earlier, learning how to self-soothe, learning how to regulate emotions, learning that emotions aren't really that scary. And often when people are avoiding it, it feels bigger than what it is. And I think with emotions, the more people are exposed to it we might use all sorts of experiments as part of a treatment episode, but as a result of exposure, there's a lot of learning that's attached to that. And the last one is empowering recovery. That's really a little bit more about relapse prevention. And what are the things that based on an individual's history, recovery journey, what are the things that are unique to them that they need to know about themselves that's going to help them? It's a little bit of like a blueprint. Thank you for mentioning the moods. First time I hear anyone mention moods. Yeah, so I think I sort of use moods and emotions sort of interchangeably, really, as well. But absolutely a very important part of recovery, and learning how to tolerate and negate, say, different mood states. Okay. So it looks like there were questions really along the way, and I'm sorry I wasn't able to answer all of them perhaps as fully, but it's really helpful, because the ones that I don't know or I don't have enough expertise in, I can find others that do. So I can always bring people in and question them, or ask, have sort of conversations about different themes that people might be interested in that pop up. So do keep questions coming in that sense. And I just wanted to highlight, we've part of a service that I'm involved in is the Eating Disorder Psychologist service, and this is a team of professionals that are psychologists, psychotherapists, dietitians, recovery coaches, and we work in an online medium to help support people with eating disorders. And one of the things that we are doing at the moment is a webinar series for parents and carers. A lot of particularly since the pandemic, a lot of referrals that we've been having from parents have been about feeling really confused as to what to do, or how to help, or how to support their young people, or teens, and people at university. And so it's just a really educational webinar, interactive webinar series for people that are interested in that. Oh, and if you wanted to access that, I think I've got it here. Okay, so this is the website where you can access those sort of courses. This is the eating disorder psychologist.com, and under courses, there's a drop-down menu, and you'll see their courses for parents and carers if you're needing access to that. And again, if you're needing to ask me anything in any way, I have my sort of Facebook, which is the Eating Disorder Psychologist, as well as on Instagram. You can follow me there as well, and a YouTube channel. And there's also admin at the Eating Disorder Psychologist. If you have any questions, or certainly if you're wanting any more information or interested in any webinars that you would like to hear a little bit more about, or any topics or themes, do let me know. Or you can go on to the Mental Health Warriors site and add comments or anything in there about what you'd like to see. And yep, thank you for your time and for being here. It's been a real pleasure, and I will be back again. I think I'm the last Monday of every month. I'll be doing table talk, so I look forward to that. Yes, or you can get in touch with us at Mental Health Warriors, who will put you in touch with me. Okay, thanks everyone. And let me come out.